I'm about to reveal something that may shock you. This might be happening in your life every single night, silently attacking your sleep, your prostate, and most importantly, your vitality. I am Dr. Richard Powell. After more than 2 decades as a urologist, I have seen perfectly healthy men enter my office with damaged bladders. This damage was caused not by an incurable disease, but by behaviors they considered completely normal. I am not talking about exotic lifestyle habits or experimental treatments. I am talking about that glass of water you drank before bed, the caffeine you consumed mid-afternoon, and even how you deal with the urge to urinate during the day without giving it proper attention. What I am about to share goes against everything you've been told about managing your nighttime incontinence, known as Nocturia. Sleep product companies don't want you to know this. Most general practitioners will not tell you because they simply don't understand the devastating connection between your bladder, your prostate, and the quality of your rest. But I have seen this with my own eyes, patient after patient, night after night. I refuse to be silent any longer. By the end of this video, you will understand the 5 nighttime mistakes secretly weakening your bladder's storage capacity. You will learn why this becomes so dangerous after age 55. Most importantly, you will know what you can do starting today to protect your sleep and your urological health. This is not meant to cause panic. This is the truth that saves your freedom. Stay with me, because what you are about to learn could literally add years of deep sleep to your life. Let's begin with the most common mistake committed in virtually every household in the world. I call it the infiltrating beverages error. You know what I'm talking about. The water, the teas, the diet soda you drink while watching TV, even the high-water content fruit you eat after dinner. They are your immediate solution for thirst. They work brilliantly. There is no denying that. But here is what no one tells you. Regularly consuming these liquids after 7 p.m., especially if you already have any signs of prostate symptoms, is like playing Russian roulette with your urological system. The medical community has known this dark secret for decades. Back in 2010, major studies already pointed to the need for nighttime fluid restriction for patients with an overactive bladder or an enlarged prostate. Nevertheless, millions of men still take daily gulps, completely oblivious to the danger lurking in every glass or cup. Let me tell you about Geraldo, a 72-year-old patient who loved watching soccer at night. He suffered from benign prostatic hyperplasia, BPH. He would drink nearly a liter of mineral water over the course of the evening to stay hydrated. One afternoon, while watching the game, he felt completely exhausted. He could not get 2 consecutive hours of sleep, and his legs were swollen. When he arrived at the emergency room, we discovered he was experiencing such intense nocturia that his body simply could no longer cope with chronic sleep deprivation. It could not handle the excessive volume of liquid processed in a short period. The trigger was not a new health condition. It was the continuous use of his innocent drinking habit. How can something so common be so devastating to sleep? The mechanism is insidious. Drinking excessively at night overloads the bladder at a time when your body is already programmed to reduce urine production, thanks to the antidiuretic hormone, ADH. But by introducing a large volume of liquid, you partially override this mechanism and create 2 catastrophic effects. First, you decrease your bladder's functional capacity, stressing the detrusor muscle. Imagine your bladder as a balloon. If you fill it too much, it triggers the signal for urgency. A young bladder can handle this stress, but one already dealing with the pressure of an enlarged prostate or struggling with age fails completely, just as Geraldo's did. Second, Diuretic liquids, and here I include teas, coffee, and especially alcoholic beverages, accelerate urine production. Even if you don't have kidney issues, regular use of these diuretics can significantly increase nighttime urine output. Furthermore, if you are already taking medication to relax the prostate, the excess liquid can completely neutralize the effect. This forces you to get up multiple times without you even realizing the vicious cycle you are in. It is critical to understand that the risk depends on the volume and type of liquid. Diuretic drinks and large volumes of water, more than 10 ounces after dinner, are most strongly associated with uncontrolled nocturia. Liquids like warm milk, which are slower to process, appear to be a little safer, but the risk is never zero. And here is another shocker. If you take sleeping pills to protect your rest, certain liquids like nighttime coffee can actually neutralize the relaxing effect of those medications. So, what should you do? The solution is not to become dehydrated. It is to have an honest conversation with yourself about your beverage schedule. Ask directly, "Doctor, given my urological history, what is the safest cutoff time for me to consume liquids?" Alternatives exist. Sometimes, sucking on an ice cube or spraying water in your mouth is enough to alleviate thirst. Other times, topical gels or creams for pain can reduce nighttime anxiety that leads to fluid consumption. If hydration is absolutely necessary, the golden rule is the lowest volume for the shortest duration of the night possible. Do the majority of your fluid intake in the morning and afternoon. Now, we come to number 4. This one will absolutely surprise you because it is marketed as a muscle and hormonal booster. I am talking about fast-absorbing protein supplements or certain amino acids, creatine, some BCAAs, or even the whey protein you take before working out. These are among the most consumed by men worldwide. Millions of people take them every night as a wellness ritual or to optimize muscle recovery. Here is the bitter irony. The supplement prescribed to build your body may be creating another danger through the back door. Let me share the story of Jose, 68, who was advised to take a high-dose protein shake before bed to optimize muscle gain. They told him to do this indefinitely. His muscles responded well, and he never questioned the habit. Years later, during a routine checkup, his blood test showed unusually high urea and creatinine levels. The analysis revealed the cause: the excess metabolized protein and the consequent renal stress. The kidneys are the guardians of your filtering function. When they are overloaded, they increase urine production to try to expel excess waste. This makes the body electrically unstable, like a machine without fine-tuning, and uncontrolled nocturia can emerge. The cause of Jose's overload: chronic use of the nighttime protein shake. Proteins require a lot of water for renal metabolism. When you suppress the acidity in your stomach or force the kidney to work later, the absorption and processing of these wastes collapse. But it doesn't stop there. Something else concerns us even more. Multiple observational studies have found an association between nighttime protein supplement intake and kidney overload. One theory suggests that these wastes demand a gigantic volume of water for dilution. This is a molecule that maintains water balance. When too much volume is imbalanced, the bladder becomes irritated, setting the stage for a night of bathroom trips. The causal relationship is still debated, but the association is deeply concerning. Furthermore, the excess of some amino acids can interfere with hormones vital for sleep, such as melatonin and cortisol, indirectly affecting your ability to relax. It can make your sleep less effective. The problem is that these supplements have been trivialized. They were created for specific uses and controlled periods. but they have become a permanent solution for problems that could often be managed with simple dietary changes distributed throughout the day. If you have been taking high-volume protein or amino acid supplements a few hours before bed for months or years, do not stop abruptly, but talk to your doctor. Ask, do I really need this long-term? Can we reduce the nighttime volume? Are there alternatives? If you must take it chronically, it is essential that your doctor periodically monitors your kidney levels. Before we continue with the next mistakes, which include some related to your nighttime leisure, I want to make a quick request. If what you have heard so far seems valuable, I am asking for two simple things. First, subscribe to this channel. My mission is to provide clear and direct health information so you can make the best decisions. Second, and perhaps more importantly, share this video. Think of your friends, your neighbors, your workout buddies. A simple click can start a conversation that could truly save someone's sleep. Thank you for your support. Let's continue with number 3, one that almost every man has at home. This is the extensive use of technology before bed, especially the blue light emitted by cell phones and tablets. They are the magical solution for that nighttime boredom that won't leave you alone. But this magic solution can come at an extremely high cost to your sleep cycle and consequently to your bladder, especially if you already have any cardiovascular disease or high blood pressure. Marta, a 75-year-old patient who loved reading ebooks, acquired the habit of spending hours on her tablet before bed. To relieve boredom, she bought a well-known device with a large screen. On the second day, she felt her heart was racing, along with terrible headaches and fatigue. Her son took her to the hospital. Her blood pressure was soaring, and she had developed rebound insomnia. The artificial lighting from the cell phone had pushed her body into wakefulness. Why does this happen? Blue light is an attention stimulant. Its job is to suppress the release of melatonin, the hormone that signals your body it is time to relax and sleep. In your brain, this is huge because it delays the onset of sleep. But the stimulus does not only act on your brain. It travels throughout your body, keeping your systems more active. This has two consequences. First, by reducing sleep, the production of your antidiuretic hormone, ADH, can be disrupted. ADH is what slows urine output during the night, so you can sleep. Without adequate production, your urine volume skyrockets. Your heart tries to pump against much greater resistance. The pressure explodes. This can result in a dangerous spike in urine volume. Second, the stress from devices is stimulating. They make your mind more alert and irregular. If you already have a sensitive prostate or an overactive bladder, this extra stimulation can completely destabilize you. Recently, European agencies have refocused attention on melatonin suppression due to its link to rare but serious syndromes involving deep sleep disturbances. This only demonstrates how powerful its effect is throughout the body. The greatest danger with these devices is that they are available to everyone. People use them without reading warnings and without thinking about the hormonal risks. If you are over 55, and especially if you suffer from nocturia or any urological condition, avoid them completely. Much safer alternatives exist. Read on paper, listen to relaxing music, or use devices with blue light filters that act only locally. Do not let the relief for your boredom become an emergency for your bladder. We come to number 2, a delicate but vital topic: medication. I am talking about a class of nighttime acting diuretics that are still sometimes used for swelling and at other times for blood pressure. Loop diuretics, or even some thiazide diuretics, names like furosemide or hydrochlorothiazide. Elevated blood pressure itself is a risk factor for urological health, a key reason why treating it is crucial. But how we treat it matters enormously, and these medications can be hazardous to your night's sleep. Fernando, 78, suffered from terrible foot pain due to swelling. His doctor prescribed a low dose of furosemide for him to take in the morning and sometimes in the afternoon if the swelling returned. It helped with the swelling, but he began getting up 3, 4, 5 times a night. One day, he stumbled in the dark and fractured his hip. The cause was furosemide, which triggered a sudden increase in nighttime urine production, called polyuria. But this is not the only risk. These medications can also increase urine production at an inopportune time, which means constant stress for an aging bladder. What is more worrying, they can interfere with your electrolyte balance, lowering potassium or sodium levels. This shows up in blood tests and increases the risk of dangerous dehydration that can paradoxically irritate your bladder even more. For all these reasons, powerful diuretics are no longer the first choice for swelling in the elderly. Today, we prefer more gradual approaches that are safer for sleep. However, they are still prescribed for resistant swelling or heart failure. If you or a loved one takes one of these medications, it is essential to speak with your doctor. Have safer alternatives been attempted? Are the medication timing and electrolytes being monitored? Mental and physical health go hand in hand. You need to ensure that the treatment for one is not harming the other, especially your sleep. And we arrive at number 1. This is perhaps the most controversial and debated point, but it is my duty to share the concern that exists in the scientific community. I am talking about self-prescribed testosterone replacement therapy, TRT. Yes, you heard correctly. The hormones that millions of men take every day to protect their masculinity and vigor. For decades, the message was crystal clear. Take testosterone to feel young. But in recent years, more and more studies are questioning the safety of these supplements for the urinary tract. Let me tell you about Carlos, 60. Concerned about loss of libido, he started taking a high dose of injectable testosterone on his own. Years later, he noticed he was having difficulty urinating and had a weak stream. He did not have the classic risk factors. He did not smoke. His cholesterol and blood pressure were fine. Investigating possible causes, his medical team focused on that daily supplement. The controversy is real, and the evidence is not definitive. But the hypothesis concerns us deeply. Testosterone naturally produced by the body or administered in physiological doses does not appear to be a problem. It is absorbed slowly, and the body uses it efficiently. The problem seems to arise with the high concentrated doses of supplements or injections that create an artificial peak of testosterone in your blood. Your body cannot use all this testosterone optimally, and the excess has to go somewhere. The main concern is that it converts into dihydrotestosterone, DHT, which is the hormone that stimulates prostate growth. This process, prostatic hyperplasia, tightens the urethra. It can contribute to retaining urine, which causes the sensation of incomplete emptying and, consequently, the need to get up many times at night, the dreaded nocturia. Some large studies suggest that self-prescribed and uncontrolled replacement therapy increases urological risk, while other studies have not found this immediate connection. The evidence is complex. For people with diagnosed hormonal deficiency, the benefits may outweigh the risks. But the lesson is clear. More is not better. The safest strategy is to ensure that your hormonal replacement is done under strict medical supervision. If your doctor believes you need a supplement, never start taking it on your own. It is a medical decision that must weigh your hormonal health and, most importantly, your urological risk. Today, we uncovered the hidden side of 5 very common types of nighttime mistakes: excessive fluid intake, nighttime protein supplements, blue light use, certain diuretics, and uncontrolled hormonal replacement. My main message is not panic. It is not to stop taking your medications or supplements. Doing that on your own would be extremely dangerous. My message is one of empowerment. Now, you have valuable information that most people ignore. You know that tea before bed can overload your bladder. You know that your protein shake might be affecting your renal balance. You know that a simple cell phone can be a serious risk to your sleep. Use this knowledge to become an active partner in your own health. The next time you visit your doctor, go prepared. Bring a list of everything you are taking and doing, including supplements and nighttime habits, and ask clear questions. Doctor, I read that this medication or this habit might have risks for my sleep and my prostate. Is it still the best option for me? Are there safer alternatives? Should we monitor something like nighttime urine volume or do specific tests? Every treatment is a balance between benefits and risks. That balance changes with age. Your bladder and prostate have worked hard for decades. They deserve exquisite care. Protecting them is the best investment you can make in your future. Do not take any habit or medication for granted, no matter how common it seems. And now I ask one last thing of you. Share your experience in the comments. Did something here surprise you? Your stories can help other people. And remember, always talk to your doctor. That conversation is the most important step you can take today to protect your sleep tomorrow. Take care.